Hello everybody and welcome back to Torn. If you've been searching for a better foundational understanding of the ACL, you've come to the right place. So first and foremost, what is the ACL? So let's break that down first. The ACL stands for anterior cruciate ligament. So what the word anterior means is essentially it means in front of. So there's two ligaments inside the joint, the ACL and then you have the PCL. The PCL stands for posterior cruciate ligament. The word posterior just means behind. So as we designate those two ligaments from each other within the joint, the ACL or the anterior portion just means the ligament that's in front. So now we have the term cruciate. So anterior cruciate ligament, the cruciate part just means cross. So that word is actually Latin for cross. So when I look at the model, you'll see this. But essentially those two ligaments that we talked about, one being the ACL, the other one being the PCL, actually form a little bit of a cross inside the joint. And the third word of the ACL stands for ligament. So ligament just means that you're attaching a bone to a bone. So anytime you hear the word ligament inside the body, there are always two bones, one connecting to the other. That's what the ligament is stabilizing. So in this case, the ACL or the anterior cruciate ligament is stabilizing the femur or our thigh bone to the tibia or our shin bone. So now that we've talked about the ACL, what it is and where it is, let's get a better understanding of it visually. So in my knee model here, let's just break this down. So you're gonna see a handful of things here. So in this model, and obviously for those who are in the medical profession, you have a better understanding of this already. For those of you who don't, this is a model of the knee itself. So you're looking at here is the femur or the thigh bone. Down here is the tibia or the shin bone. If I kind of pull that back there's your kneecap. That sits right in the groove between the two bones, okay? As I start to pull this back, what we see is a handful of things. First and foremost, you see the meniscus, right? All that does is provide a little bit of a cushion. I'll talk a little bit later on in other videos about what the meniscus provides specifically. But as you see, kind of coming across that, there's your ACL. So if I tilt this down a little bit so you can have a better visual of that, the ACL is in alignment here. So you can kind of see where it connects to the femur itself. It works its way down across the joint and attaches onto the tibia. So to provide a better understanding of where to locate the ACL, break it down, right? So there's two ligaments within the knee that both provide stabilization to the joint, the ACL and the PCL. The ACL, obviously the one we've been talking about, is there. If I open that knee up a little bit, you can kind of see the PCL in the back, and I'll turn this around in a second, but you can see where it forms a cross. So break down the word ACL, so anterior meaning forward, cruciate meaning cross, and ligament obviously connecting the two bones together, okay? So if I turn this around, there's where you can see the PCL. So if I open that up, there's where you see the cross. You can kind of see the ACL a little bit in front. If I turn that around again and open that up and pull it apart, you have your ACL in front, and if I rotate that a little bit, you can kind of see the PCL back there as well. So the primary goal of the ACL is to resist the shin or the tibia moving or translating, as we call it, too far forward on the femur or the thigh bone. As you can see back in the model, I have a side profile of the knee itself. So we have our femur here and the tibia down where my other hand is. This is the front of the knee and this is the back of the knee. So the primary goal of the ACL is what we call anterior tibial translation, or preventing that. So as we just mentioned, it's providing less of a shift forward of the shin on the femur itself. So as I move this, you're going to see a little bit of that shift, okay? So someone who has a deficient ACL, you will see that shift be much more than it is, particularly when the knee is slightly flexed. So for those of you watching who just want a more simplistic understanding of the role of the ACL, take nothing more than its primary job is to resist the shin moving too far forward on the thigh bone. If you're looking for a more in-depth understanding, a secondary role of the ACL is to prevent what we call internal tibial rotation. So now that we've talked about what the ACL is, where it's located, its primary and secondary roles, let's talk a little bit more about what happens when the ACL is torn. In order to do that, I like to use the word mechanism of injury. Essentially, all that means is in what position is the knee located for that injury to occur. So before we look at the particular mechanism of injury of what the knee looks like when it tears, let's talk a little bit about the different scenarios in which you would see an ACL tear. Specifically, you see ACL tears in very quick changes or very abrupt changes in speed or direction, usually involving some sort of cutting, landing, pivoting, shifting event that occurs during sports. So as we look at this image above, I want to provide the caveat that this isn't the only way in which an ACL is torn, but it just tends to be the most common way. So when we look at video analysis and some of these other ways we dissect, how an ACL is injured, this tends to be more or less the most common way in which it's torn, although there are other ways. So you can have hyperextension injuries, you can have, even traumatic events like a car accident can cause an ACL tear. So keep that in mind as I dissect this mechanism here leading from the foot, knee, hips, all the way through of what that looks like, that in the back of your mind that that it's not always the case. So keep that in mind as we go forward. So as we look at this image, we see a few things going on. And to dive deeper into this, I want to start down at the foot and then kind of work our way up the chain to the knee, the hip, and then eventually I'll talk a little bit about what's going on at the torso as well. So if we look down at the foot, first and foremost, we see that foot is firmly planted. There are very few circumstances in which the ACL is torn that the foot is not firmly planted on the ground. I tend to have this conversation a lot with athletes who are going back to a sport like soccer, where they're a little bit hesitant to kick the ball with that operative side or even go into a tackle with that operative side, especially when they get back to training or sport. So I have that conversation just to let them know that the majority of the time that foot is going to be safe. Usually it tends to happen where the foot is firmly planted, as we discussed earlier, where there's an abrupt change in speed or direction as opposed to the foot being off the ground. So aside from the foot being firmly planted, there are a couple other things going on down at the foot that I want to discuss in a little bit more detail now. So if you are medically inclined or want to have a better understanding of some of those minute changes that you see down the foot, let's talk about that now. So in the image you see what's called ankle eversion. I want to change that name a little bit to what's called ankle pronation. A pronated foot has three different components, and I'll put those up on the screen now. The first one being that the foot is abducted. So an abducted foot, if you're looking at my foot here, this is my foot, this is my thumb or my big toe. If you're looking at my right foot, an abducted foot means that the foot is moving away from midline. Adduction, or ADD, means that the foot is going in, right? So inside of midline. So that's the first component. The second component would be an everted foot, kind of as you see written down on the image there. An everted foot means, as opposed to going in and out, what we see is a little bit more of this happening here, right? So an everted foot just means that the foot is actually falling in. So if you're looking at that image there, you kind of see that foot falling in a little bit. The opposite of an everted foot is what we call inversion. Sometimes we see inversion when we talk about an inverted ankle sprain. That's very common in that position there. But when we're looking at ACLs, we see what's called an everted foot. The last component of that we see is what we call dorsiflexion. So if I'm looking back at my foot here, a dorsiflexed foot just means that the foot is coming up slightly compared to neutral. A plantar flexed foot, the opposite of that, is where the foot is facing down. It's a little bit difficult to see in this image itself, but those are the three components of what we see typically going on down at the foot during an ACL tear in this mechanism. So now moving our way up the chain, we looked at the foot. Now let's look a little bit more at the knee and hip. In this image, you see what's called dynamic valgus. The dynamic valgus is a combination of a couple of things. Let's start down at the knee. So what we see in that image is what's called a knee abduction, similar to how I just described the foot. An abducted knee, essentially looking from the knee down, just means that that foot is moving away from midline. What we also see going on at the tibia, or the shin bone, kind of, obviously looking at from the knee down, the tibia, is what we see as an external rotation. So external rotation just means that the tibia, if this is my tibia here, is moving out slightly. So there's a little bit of a rotational piece at the knee. The combination of an abducted knee and an externally rotated knee combined with what we see up at the hip, in that image you see what's called a hip adduction. That just means that the hip is falling inside midline. So you can see in the image, if you drew a straight line up and down a proper lined body, that is falling inside of that line. The other movement that we see up at the hip is called an internal rotation of the hip. The combination of what you see at the hip and at the knee itself, or the femur and the tibia, that's what we describe as dynamic valgus. So the video I have up now is of an athlete who is going through an ACL tear in that moment.
So if you're not inclined to watch this, you can certainly skip on. But what it does provide is a very good understanding of what's going on from the torso, the hip, the knee, the foot. So if I break this video down, first and foremost, you can kind of see that they're cutting from left to right. There's a defender behind them, so they're making some sort of move. Obviously, when we cut, we have to decel slightly. So that's the portion of the actual motion that they're making. So there's an abrupt change of speed, but also a change of direction that causes this. So if you're looking down to foot, you can see exactly as I described earlier what's going on down there. You look at the knee as that falls in, you look at the hip, but I want to look a little bit more at the waist and the torso itself. As that individual is making that cut, they're cutting onto their left side. You can very much see that their torso is actually leaning to that side. If you break that down even more, you can kind of see that lean tends to happen just slightly sooner than the knee falling in. So there is some aspect to what we call frontal plane stability, meaning that we want to very much control when we cut or land or change directions. We want to control what's happening from the waist up. That's why in a rehab setting, working on core in different directions is very important, because in this video, obviously, you see a huge lean to that side. So now that we have a better understanding of the mechanism of injury for an ACL tear, let's go into a little bit more depth of the different categories or the different demographics of athletes that put them at a slightly higher likelihood of tearing. In this video, I'm going to break it down into 3 different categories, probably the 3 that put you at a slightly higher risk. There are a myriad number of other kind of correlations or different combinations of things, modifiable and non-modifiable factors that put you at a slightly higher risk. But just for the sake of being simplistic in this video, let's break it down into probably the 3 more important things, and we can go from there in future videos. So the first category I want to look at is what we call a level 1 sport. So we see slightly higher tear rates in level 1 sports. Level 1 sports includes, football, soccer, basketball, skiing would be considered a level 1 sport, where you see high acceleration, deceleration rates. You see a lot of contact in those sports. You see high amounts of cutting, landing, pivoting, shifting, changes of direction. So in level 1 sports, we do see slightly higher tear rates. Second demographic or category that I want to break this down to, and obviously, as we mentioned, these are 3 more simplistic demographics that I want to break down. But the second one we see that I'm going to talk about is male versus female. The female population actually has what we see in the literature is a 3 to 7 times higher likelihood of tearing compared to their male counterpart. So specifically, we see female tears happen probably more so in soccer. We see them in skiing. We see them in some of these sports. Lacrosse is probably another one I would put in that category, but especially soccer. And as we see in future videos and me interviewing with some of these high-level soccer athletes, they talk about this as well. Just the pure number of ACL tears that happen amongst the female population, specifically in that sport itself, is very, very high, and that probably does fall into that 3 to 7 times higher likelihood tear rate. So the last category that I want to break down is not necessarily a demographic, meaning level 1 sport or male versus female, but it is very important to understand that ACL tears generally happen in non-contact injuries versus a contact injury. So a non-contact injury means, if I'm defending someone and I have to make a very quick change of direction to defend them or change my position to get to them first, whatever the case may be, that's when you see 70% of all ACL tears, what the literature describes, are all from non-contact injuries. Contact injuries usually happen from, as we see in NFL games or on these videos of these very grueling injuries where a tackle to the knee, or you're making, you're in a pile up and someone falls on the knee itself, causes the ACL to tear. But generally what we see in the literature and when we look at video analysis is non-contact injuries. This generally falls 70% of the time. So the last thing I want to talk about is a little bit of a better understanding of what an ACL tear looks like. Specifically what the knee looks like when an ACL tear occurs. So if you're an athletic trainer or a parent, a coach, and you're seeing an athlete or you're seeing your athlete, whatever that case may be, what their knee looks like is actually fairly important, and how the athlete describes what happened on the field can kind of give you a better understanding of, okay, is this something we need to look at further? Could this be a potential ACL tear? How do we describe that? So that's what I want to describe a little bit next, kind of looking at a little bit more of what the athlete says, how the knee responds to the injury, those types of things. So one of the first things that is described by the athlete is that they hear an audible pop. They feel a pop, they hear it. That isn't always the case of you're going to go directly to that being an ACL tear, but it does kind of put you in that position where it's, you want to consider that and rule an ACL tear out when you hear an athlete describe it that way. The second thing I would say is what's going on at the knee is you see immediate swelling. This can be the case if you see fractures or there's bruising at the knee, these types of things, because bone has a lot of blood flow. But along with that, when an ACL tears, there is swelling or what we call hemarthrosis, meaning that there's blood in the joint. That happens within 1 to 2 hours. I will kind of give the caveat, and this is, for those interested in more of the medical side of things, ACL swelling tends to happen much earlier than if I had an isolated meniscus tear. Meniscus swelling tends to happen, 12, 24, or even 36 hours later. So that can kind of give you a little bit better of an understanding. It's not always the case, but it would tell me, to some degree, okay, is this an ACL? Do I need to be a little bit more concerned that it could be? Or is the swelling happening a couple days later? Maybe that's more of a meniscus related pathology. So another couple of things that you might see, one being range of motion loss. Obviously that athlete's in pain, there's swelling within the knee. Another interesting thing that you might see if you're a physical therapist or an athletic trainer or even a physician is range of motion loss can sometimes be due to a concomitant meniscus tear as well. So specific types of meniscus tears that are involved with the ACL itself can cause range of motion loss where the athlete describes, I just can't get my knee to bend any further. So they feel like they're hitting some sort of brick wall. And when I feel an athlete who has a meniscus tear involved with the ACL, sometimes the meniscus tear can kind of cause me to hit that end range, and I can kind of feel that. So we can kind of talk about that a little bit more in other videos, but just know that that could be a factor that meniscus tear is involved with this. Another thing that you will see and described often amongst the ACL population or athletes who have torn their ACLs is an instability event, or they feel like the knee is going to give way. Whether it's walking stairs or even just performing daily normal activities, there are instances where the knee just wants to give way because you don't have the stability of the joint anymore. So when that knee shifts forward or that tibia shifts forward, that causes what we consider to be a knee giving way or an instability event. So aside from, the swelling, the pain, everything else that an athlete's saying where they felt the pop, we do see range of motion loss, we see instability, and this can kind of give us a pretty good understanding of, okay, we need to look at this further because it could be a potential ACL tear. So now that we have a little bit better of an understanding of the signs and symptoms of an ACL tear, how an athlete describes an ACL tear, potentially the instability events, or even the pop that they feel, what happens next? So the transition period I want to make into the next video is exactly that. So we'll talk a little bit about, what happens when an athletic trainer or a physio such as myself or a physician goes out onto the field and they suspect an ACL tear. What does that transition period look like from the field to speaking with a surgeon for the first time? So click the link above. My next video is me interviewing a surgeon, specifically a knee surgeon who deals with these kind of injuries often. I'll speak with them about the first conversation an athlete and their parents might have with that surgeon, the potential imaging and what we do next, all the way through the surgery process, what it looks like in the operating room, what the athlete is going to be going through, what the surgeon sees during the operation. And now going forward, we're going to talk a little bit with that surgeon about what that looks like from a rehab process with the physical therapist and the athletic trainer, the strength coaches, etc. So click that link above. This is a great transition period from understanding the ACL, what we talked about at the beginning of what the ACL is, where it is, all the way through the process of it being torn. Now let's transition into that conversation with a surgeon and where we go from there. Thanks for watching. If you're a physical therapist or other medical professional looking to elevate your ACL rehab practice, visit tornuniversity.com and book a one-on-one consultation where you can speak with me directly about any specific challenges you may face and fine-tune your approach to ACLs. Also be sure to check out my monthly webinar series where I dive deeper into ACL-related topics designed and shaped by your specific needs and questions. Don't forget to like, subscribe, hit that notification button for more content, interviews, and more. Follow me on social media at Torn University for more daily ACL related topics. And as always, drop any comments or questions you may have about ACLs, and I'll catch you guys in the next video.